Hello, good evening. This is Dr. Maria, integrative medicine practicing in Pasadena, California. I practice integrative anti-aging, and today I would like to discuss or talk about what happened to the thyroid hormone or the thyroid gland we have. Now, where is this thyroid gland? Thyroid gland is located at the base of our neck, and it is a shape like butterfly. And the function is to produce thyroid hormone, and it is an endocrine hormone where we burn our calories using this hormone. And today is a very special discussion regarding thyroid and diabetes. According to the studies, they actually link together. It can affect either way. 5 out of 100 Americans have a hypothyroidism over the age of 12. So that's about 5% of the populations. Hypothyroidism is a low function of thyroid gland to be able to give us enough thyroid hormone. So this is most common in adult over 60 as well. Up to 60% of those with the thyroid disorder, they're not aware of they have this thyroid problem. Most likely, many doctors also look at the standard reference range, which many of them have normal number, which is within the standard reference range, but they have symptoms. Women are up to 8 times more likely than men to develop thyroid problems. 1 out of 3,000 newborn has hypothyroidism in United States. Well, that can lead to irreversible mental retardations, not reversible. Fortunately, screening for newborn hyperthyroidism or hypothyroidism are mandatory in all 50 states. So at least we can screen it while they were catched by the pediatricians. Sometimes the thyroid begins to overgrowth. So that means hyper, causing one or more nodules to form. This is another form of thyroid problems. Cancer is the biggest concern. Fortunately, cancer is less than 5% of all the nodules found in thyroid. This happens in people who don't get enough iodine in their food. Well, we are glad that the salt table now has an iodine, and of course, we are recommended to take the iodinized salt. And treatment options for larger or cancerous nodules may requires or includes medications or anti-thyroid or even surgery. Some symptoms of this hyperthyroidism that includes irritability, muscle weakness, tremor. Some of them miss their menstrual period, weight loss, difficulty sleeping, enlarged thyroid. You can see it's enlarged because it's active, trying to get more hormone, but they cannot get it, so they keep working, and so it's enlarged. Just like if you overwork your muscle, then it's bigger. Vision problems or eye irritation, shortness of breath, clammy skin, thinning hair. Some patients have flushing skin, heart palpitation. It could be rapid or irregular beat. That was the hyperthyroidism. Now we talk about the hypothyroidism or low function. The symptoms is similar, but here is more fatigue, heavy menstrual period instead of missing, weight gain because it's low metabolism, dry skin and hair loss also, sensitive to cold and temperature. They feel cold all the time, hands and feet, and they get constipated and they feel depressed because you don't feel good with this. Also, the other one, they can feel depressed as well. There is a disease called Hashimoto's, and that's an autoimmune disease. It's the most common cause of hypothyroidism in America. The following risk factor can cause Hashimoto's. So there are risk factors. One, if you have general hormone imbalance. Two, food sensitivity. For example, sensitive to gluten, dairy, soy, eggs. Three, nut, peanut, shellfish. Third one is leaky gut, weakness of the gut due to parasite, candida. The fourth one is infection. It could be Lyme disease, Epstein-Barr virus, or tick. The fifth one, nutrient deficiency, especially iodine, magnesium, iron, and zinc. And toxin, exposure to heavy metals, mycotoxin, pesticide. Okay. So all of those are risk factor. So you can imagine all of us live in a very toxic world. We are exposed to those. We have to be very careful. Now, when I learn my hormone, I always learn this way. The brain, we have HPA axis or hypothalamus and thalamus and pineal gland produce all the hormones that actually control the other hormone under them. So it's almost like a tree, right? The top one is the master. That's why it's called master hormone, which is human growth hormone. And thyroid is here. It's still high. And then we have thymus, we have adrenal, we have pancreas, and sexual hormones from ovarium. And so the higher the level is the most important. But you have to understand, when it's thyroid comes into a situation where it's a problematic, the person doesn't even know it, even they have seen doctors. That's because, like I said, the reference range is very narrow. The range is very narrow. And when you fall in within that range, the doctor think it's fine. As an integrative medicine specialist, we learn how to diagnose what we call subclinical thyroid, almost similar as pre-diabetic. You're not diabetic or no diabetes yet, but your number suggesting that you are almost there. The same thing. So subclinical thyroid covers 12% of US populations. 50% of them are overtreated actually. All thyroid hormones, the level when it's normal in reading, but the brain keeps sending signal to produce more thyroid. And if the patient has those symptoms, then we can call you have a subclinical thyroid. Not obvious, but it is the hypothyroidism usually. And I treat these patients, and I just either check if they have iodine level that are very low, then I treat them with iodine. So this is a low iodine cause hypothyroidism. Then I'll check level of magnesium, which is the mineral. And I do find it's better to check the red blood cell instead of the plasma. And then I give supplements that has, glandular thyroid if their thyroid is not very strong. The number is not very strong, and the thyroid stimulating hormone is high. That means it stimulates the thyroid gland to produce more hormone. The treatment is not difficult for thyroid situations, but to reverse the thyroid disease, which is reversible if you want to, it's very difficult. Now, why is that? Because it requires changing of your lifestyle, and you need to detox, and you have to be on strict diet with low gluten and sugar. Actually, the all 6 pillars of healthy aging in my book called No Code Medicine to reverse hypothyroidism applies. To reverse the thyroid situation, all the 6 pillars applies. Those are detoxification of toxin, your diet, your nutrition supplement, your stress management or reduction, your exercise, and also hormone balancing. So all 6, if you can focus, you might reverse your thyroid problem. Small percentage are able to reverse it, and the rest will take the supplemental hormone for the rest of their life. To diagnose thyroid disease, your medical doctors requested usually blood test, and it's TSH, thyroid stimulating hormone, T4, T3, free T4, and free T3. Now we know that the free T3 is the final hormone that we can use, and some of these blood tests extend to reverse T3 or thyroglobulin antibody, or so this is if any of these are normal and patient are very symptomatic, we have to think about maybe infection or inflammation of the thyroid itself or the autoimmune disease itself. Okay. Then another way to diagnose thyroid disease is by doing 3 imaging tests to see the nodules. So you do ultrasound or CT scan or MRI. Now we know ultrasound and MRI does not have radiation, but CT scan has radiation. Of course, the last one is physical exam. You can just look at the neck and see if they have goiter or enlargement of the gland, or you can palpate and ask them to swallow and then see if the surface is normal, or sometimes we can easily palpate the nodules or the tumor. Sometimes the patient have the tumors and nodules, they don't even know that they have it until somebody else said, oh, I think your neck is not symmetric because I see the right side is bigger. Then they come and ask the doctor. Birth control pills with estrogen or progesterone or both can cause thyroid problems because again, it's hormone. Any hormone you take, it can cause thyroid problem. This is where thyroid links to diabetes, because diabetes is a condition where insulin is involved. And also, if you're pre-diabetic or diabetes, you should check your thyroid, because also, again, the regulation of the sugar gluconeogenesis does affect the thyroid gland function. Whether someone has a thyroid problem and is taking birth control pill, their healthcare providers would monitor their thyroid level. Endocrinologists, I often work with endocrinologists, and there are integrative endocrinologists nowadays, believe it or not, because integrative medicine has been approved since 2014. So that's 6 years ago in April. So there are many of these specialists trying also to learn what is it in the integrative medicine that can improve their patient's health instead of just using drugs and not the alternative medicine or complementary medicine. One of the doctor, Dr. Michael, Alexander Michael of Cleveland Clinic, they study about effect of thyroid hormone and the birth control pills. So, I'm sorry. Let's talk about medication for hyperactive thyroid. If your thyroid is hyper, then physician or we have to give you what we call anti-thyroid drugs. These are medications that stop your thyroid from making too much hormone. Many doctors, if they cannot control, they just use radioactive iodine. This treatment, of course, will damage some of the cell in the thyroid, but that preventing the cell from making high level of thyroid hormones. And also beta blockers, which is usually used for hypertension, also being used. This medication does not change the amount of hormones, but they help control your symptoms, beta blocker, because you have a lot of palpitation or irregular heartbeats. And last thing is surgery. More permanent form of treatments, and your healthcare provider may surgically remove your thyroid, and this will stop it from creating hormones. Then the patient will need to take thyroid replacement hormone for the rest of their life. Treatment of hypothyroidism. That was hyper, now is hypo. Medication that is commonly used is called thyroxine. It has T4, and the newer one is called leothyroxine. It's T3, or other thyroid hormones. They are amarthyroid, WP-thyroid. There are several, including biothyroid, or where you can compound it through the compounding pharmacy. I like to use that because then we can more precisely monitor it. Then we have to check or give iodine and magnesium as necessary because these two minerals seems to help thyroid gland to produce better hormone. By using a medication, you can control thyroid disease and live a normal life. Thyroid hormone becomes the most prescribed drugs in United States. Not statin for the heart, it's thyroid hormone, because every time we put someone on thyroid hormone and they feel good, they don't want to get rid of that, and they would just go with their lifestyle with the medication. with the medication. If you take this thyroid hormone, you take it with empty stomach in the morning, about 30 minutes to 1 hour. It's best if you can have that 1 hour window, but if you cannot have 1 hour window, I said at least 30 minutes. Now, why is that? Because other pills like multivitamins that has calciums, or if you drink milks, that slows down the absorption of the thyroid hormone, and so it does not give you the most effect of the hormone you prescribe. So basically, if you cannot have the 1 hour, you have half an hour window there where you take your thyroid in the morning, because you have to take it in an empty stomach. It gets absorbed very well. Now, if you do that consistently, then it's okay, because then we can adjust the medication if we need to increase it. But just give us that consistent taking the medication with empty stomach. Okay. So talking about factors preventing the hormone to get absorbed includes iron supplement. So many multivitamin has iron in there. Aluminum hydroxide, which is found in some antacids. If you take antacids, then there is aluminum. Then calcium supplement, like I said. What about iodine? Iodine can cause subclinical hypothyroidism or Hashimoto's or hypothyroidism. So we usually test the iodine level if I suspect you have thyroid problems. In United States, until the Fukushima leaks accident in Japan happened in 2010, iodine deficiency was very rare. However, we can use 24 hours urine collection, and then you provoked it with 50 milligrams of iodine. This is a very smart test that was designed by Dr. Abraham Gee. Actually, he mentored me in this field. And so we test, if you take 50 milligram of iodine and you collect your urine for 24 hours, you expect if you have full iodine level, so you will see the 50 milligram will come out. However, if you don't and you see, let's say, absorb 50%, okay, so 25 will be absorbed and you see 25 milligrams in your urine, then you know that you need iodine. It's very simple test, but at least you know how to treat patients with iodine. Now, if it's too much iodine, and the iodine will actually show up in your skin as a rash, but it's not itchy, but blotchy, right? Blotchy. And it's very rare. In my practice for 35 years, I saw one person that has too much iodine after we treat. And then so we just reduce the iodine and the blotches will go away. Supplement of iodine, we usually test it after 6 months. It's not easy to get up in the level. Iodine helps the glandular thyroid to produce the hormone. So if iodine is not the cause of hypothyroidism, then we do not need to give you iodine. Then we just give you the hormone supplements. Let me see if there is a questions. What is goiter? Thank you for asking. Goiter is enlargement of the thyroid gland because of the hyperfunction, or even if hypofunction, thyroid is not there, and the brain keeps sending a signal, and the T acids goes up. Usually, when T acids goes up, then you have the symptoms, but many times it's not enlarged. But if you have liking of iodine, and the gland will enlarge, and you can see the person has a big neck, so that is called goiter. Thank you, Victor. Victor is talking in Malay. Okay, thank you so much for listening. So here is the preparation for patients to see integrative doctors. See, the reason I do what do you call this, YouTube live or streaming like this, to allow you to ask questions like this. So I heard many of my patients' friends would like to come, but either they are too far, sometimes they don't have the insurance that I cover, and then they don't come. They would like to talk. So this is the time. So if you can subscribe and then share with your friends, and so they can share with other friends, that will be good. So I would like to tell you about this, how to see or come see me or integrative doctors, okay? especially when you have to pay, right? You only have like an hour for initial consult. So bring the latest test you want your doctor to see. So the latest test is usually within a year, it's still good. But if let's say the last time you saw the doctor and blood test or thyroid test was like 3-4 years ago, is no good. How about 2 years? Well, if you're in doubt, just bring it. Okay. Number two, be aware of any pre-appointment restriction. So when you call for an appointment, you ask if you can have a blood test right away, so you don't have to go back and forth, especially now during pandemic. People don't go to see doctors that often. We talk over the phone, but how about the blood test or urine test? So you ask, can I come for the first time and I want to have my blood test done? So then there is a pre-appointment restriction where you cannot eat for 10 hours or 8 to 10 hours. If you're diabetic, if you have diabetes, then it's 8 hours. Okay. So the third one is you should write down any symptoms you're experiencing. Be specific of what you need to improve. This is the goal. I usually ask, okay, what's the goal for today? And then I write at least 3 goals, or maybe only one is fine. But if you have several goals, I will choose which one would be the first 3 that we can accomplish within 6 months. Write down key personal information like recent life changes. This is the stressor, which very important in appointment with me. Okay. Bring medication list. You can bring initially medication list, vitamins or supplements you're taking. But when the result of the blood test that you have it in my office is done, that is when you really want to bring your supplements, because I don't mind you take your own supplements. I don't mind, but I will teach you how to select good supplements, because with the good supplements, with the high quality, you can use the supplements for medications. And then last one is you write down questions to ask your doctor. So with this, I've seen many patients now are doing this one. I'm so happy. And with this, I think it would be easier and you go home smiling. One moment. Here's another question. Okay. What is the natural food supplements for your treatment for thyroid? Selenium is good. Selenium is minerals. Now, according to National Institute of Health, NIH, selenium is a trace element that plays a part of thyroid hormone metabolism. You take 100 to 200 milligram a day, that's good. And then I would suggest don't take too much sugar. Okay, when you in your diet, avoid sugar. It's almost like diabetic diet is good for thyroid. Seriously. If you want to take vitamin B, then choose the methylated and chelated one. So methylated folate, methylated cobalamin, or B complex. Probiotic would helps a lot. Probiotic, because there are 4 different thyroid gene now that are found, and many of these link to the gut. Gluten-free diet, because gluten is very harsh for your gut. And then iodine is very critical for thyroid. And the zinc. I would do 50 milligram zinc bisglycinate. For hypothyroidism, the diet is to exclude some of this food. Industrial seeds, industrial oil. So that would be like canola oil, vegetable oil. So you used to cook with avocado and grape seeds, right? For coconut oil, you buy the one that is pre-packaged, small one, so you can just use it. Because if you buy in the bottle, once you open it and you keep doing it, then it gets rancid, then it will not be good. But it's a high heat tolerance. Okay, then let me see, for hypothyroidism you exclude like peanuts and yeah, legumes. This is peanuts, and then all dairy product. Sugar, like I said, the even the substitute like sucralose or xylitol, aspartame, just avoid that. You can do stevia or monk fruits or sugar. That's okay. Then you avoid alcohol, coffee, chocolate, all processed food, dried fruits. Dried fruit is sugary, right? Now, how about vegetable? Now, we recommend vegetable except nightshades. And then all protein, including eggs, beef, pork, seafood, and poultry. How about non-dairy fermented food? That's like apple cider vinegar or kombucha. And you can do the herbs, garlic, turmeric, ginger, and then bone broth, green tea, and small amount of organic honey is okay. And fruits, but low glycemic fruits. Like just avoid the cantaloupe, honeydews, banana, pineapples, mango. So the rest is okay. Like apple, pear, and kiwis, then all the berries. All the berries are good except blueberry is acidic, but it's still good. High antioxidant. Okay. Now for the hypothyroidism and hyperthyroidism, all these endocrinology situations, you need to avoid or cut blue light exposure. What is blue light? Blue light is light emitted from most electronic device like your TV, your cell phone, and then you should try to see how to meditate, pray, to reduce stress. You have to find out how to reduce your stress, the way to reduce your stress. Some people do yoga, Zumba, you know. So this is, you have to know who you are. Find the time to write down all of these and then think if you want to live longer and healthier, right? And then the rest you ask me and then I will tell you. So exciting area of medicine is actually using peptide therapy. Peptide is just protein, except that they are much shorter in molecular chain length. They use peptide and is very popular recently. Certain peptide seems to reduce a lot of inflammation. It's very important to treat hypothyroidism. Okay, now see if there's another questions. Are all dentists using thyroid guard when they're taking tooth x-rays? You know what? Such a good questions. But you know the apron, I don't know if it's high enough because the thyroid gland is at the base of your neck. So maybe you should remember when you go to a dentist and have this CT, just pull this apron above, like a little bit there, right? That's a good question. You should guard your thyroid gland. Thank you, Victor. Thank you so much. Okay, I think let me see. Is there any other questions? I think yes, that's it. So I'll see you again next week. I'm Dr. Maria Cilindro, practicing integrative anti-aging in Pasadena, California. Do like, subscribe, and share if you like this program. And the program's goal is to increase community awareness of integrative medicine and common condition. Thank you so much, and you can still suggest in the comment box in when in the video. Thank you for listening and doing interactive with me. Thank you.